Hi, I'm Dr. Caryn Bray with Women's Care Florida. Menopause, by definition, is when our cycles end and our ovaries stop producing hormones. When we talk about hormonal therapy to treat this phase in our lives, there are many options. We have bioidentical hormones, gels, creams, patches, tablets, and it really doesn't matter what we choose. For certain women, there are some issues that they have that we need to tailor their treatment for them. But the bottom line is one needs to weigh benefit versus risks. And if the benefits of hormone replacement will help them with all of their symptoms and protect their bones and maybe even provide some cardiovascular protection with respect to their cholesterol and lipids, then it's worth them choosing a hormonal therapy. One has to always keep in mind that there is a big question whether taking hormones during our menopausal years will increase our risk for breast cancer. We don't really know. Obviously, one needs to continue to get yearly mammograms, especially if you're going to be on hormones. Many breast cancers are estrogen-dependent tumors. We are exposing your breast to estrogen longer than what we were destined to be exposed to. And again, one has to just weigh that benefit versus that risk and figure out what's appropriate for them. Gynecologists here at Women's Care Florida are available to help you navigate this time in your life and tailor the treatment that is appropriate for what your needs are.